Okay, so if everyone is ready, the next poster group will be preschool vaccination booster uptake in a semi-rural general practice. The presenter is Flora Williams-Burton. Flora, will you make a start, please? And I'll just move your slide on.
Thank you. Vaccination rates have drastically declined in recent decades, posing risks to UK children. My name's Flora, I'm an F2 in Trent, and today I'm presenting an audit on vaccination uptake in my community, which was done during my GP rotation. The objective was to assess preschool booster vaccination rates and intervention efficacy. The audit was conducted in a semi-rural primary care practice using System 1 data, and the standard was set at 87% vaccination for 3-year, 4-month to 5-year-olds, aligning with the QOF guidelines. Data collection focused on the vaccination containing diphtheria being given within the previous 20 months, as this covers the window for 5-year-olds and excludes initial vaccinations for younger children audited. Findings unfortunately revealed that our practice fell short of the standard, with only 77% of patients receiving their preschool booster vaccination within this window. Exploring the reasons, a systematic review by Kaufman et al. Highlights key barriers to childhood vaccinations which are relevant here, including healthcare professionals' communication, concerns and beliefs among patients, and a lack of knowledge due to misconceptions surrounding vaccines. Next slide, please. To address this, we implemented interventions based on the behaviour change wheel by Mitchie, Strallen and West. Text messages were sent to guardians and posters put in the waiting room aimed to raise awareness. After 6 weeks, a repeated audit showed an increase to 80.7% vaccination, but this change was not found to be statistically significant. However, follow-up with the original cohort revealed an increase to 86% vaccination. This has been compared to historical data, but is outside the scope of this presentation. Considering these results and my community, targeted interventions and multilingual posters may have been more effective, given our diverse Eastern European community with limited English proficiency. In conclusion, while vaccination is crucial for patient safety, uptake remains below QOF standards. Recommendations from this audit include considering community demographics when planning interventions and maximising opportunities for patient discussions. Thank you.
Thank you. Joanna?
Thank you very much. What lessons have you personally learned from carrying out this piece of work?
Personally, I've learned a lot about how to structure an audit quite independently, as due to other commitments, there weren't many staff available to help me. Findings were shared in meetings, and obviously other clinicians were involved in posters, but it was a lot of intervention done by myself. I found the systematic review by Kaufman et al. Super interesting, because there were so many things that we don't even think of as clinicians as barriers to healthcare. So things like having childcare for siblings if a child needs to be brought in for vaccinations. It's not something that normally occurs to us as a barrier, but can be for a lot of our patients.
Yes, absolutely. I find that very interesting myself, looking at the different barriers. And is there anything that you would do differently next time if you were to repeat such a similar audit in another location, perhaps? Anything you would do differently?
I'd like to do it in a bigger GP practice, perhaps either fully rural or a city, to see if the findings are consistent across different areas. I also would have liked to have a longer window for my intervention to take effect, as 6 weeks was quite a limited window. Unfortunately, it was just because of when I had access to the data. But with a longer intervention, that might have given a clearer picture where there wouldn't have been any overlap with the cohorts.
And again, as you said, you did a lot of the work. How might it be made sustainable for the future going forwards?
So I have shared with the practice the findings. We've had a discussion at team meetings, but communication with other professionals and sharing of these findings is going to be essential for maintaining the momentum of change and making sure that all these interventions carry on once the person who initiates them has left the area.
Excellent. Thank you very much.
Thank you.
Okay, thank you. So